Alright, this is inserting the nasogastric tube. I didn't realize we didn't have the equipment, so I'll kind of be going through it. Hopefully this is good enough, I'm not sure. So to start off, of course we'll enter the room, check for medical records, perform hand hygiene, check if we need PPE. We also, once we get to the patient, we'll identify the patient, explain it to him. Also assemble all the equipment that we would need. I know we need a basin, 2 basins, one for the patient, one for yourself, a water cup for the patient to use. We also need a pad like this. We also need a tube. This is just for reference. I didn't know we didn't have it, so I'm just gonna use this as reference. This little tube, the suctioning tube. What else we need? We also need a pH indicator and something so we can get a sample in this syringe. And for now, I'm also gonna use this as a basin, kind of. To start with the nasal tube, I'll put on some gloves just for the patient safety and all that. Well, to start off, this would also, I already have washed my hands, so I could touch this if I want. This will also be a non-sterile technique. So, to measure how much we would need, we would put it up to the nose, back to the ear, and down. I believe it's the nostril, and then to the earlobe, and then to the xiphoid process. I think that's what it is. So after we do that, we would put on gloves, or down gloves, as you can see here. Oopsies. These would be non-sterile gloves, just basic gloves. These would be clean gloves. Then, next, we would use the lube. We also need lube. We would use the lube to lubricate the tip of this, tip of the tube. At least 2 to 4 inches of water soluble lubricant. Before we put this in, we would also ask the patient to obstrude both nares to see which one she breathes better out of, whichever one she breathes better out of, and then we would choose one that's like the clearest. And now to insert it, you just gently insert the tube into the nostril, directing it upwards, of course, and backward along the floor of the nose, so you kind of go up, down on the floor of the nose. That's what you want. The patient may gag also, so you gotta be careful with that. If he gags, you need to stop. So once the tube reaches the pharynx, it's normal for the patient to get teary-eyed or wateriness in the eye. You want comfort, reassure the patient is normal. So once the pharynx is reached, you instruct the patient to touch chin to chest. You also have somebody with you, or if the patient is able to hold a cup of water, so when they drink. And every time they swallow, you would advance the tube downward in a backward direction. Every time they swallow, of course. And if the patient starts gagging or anything, you need to stop. Also stop when the patient breathes. If it ever gets stuck, just rotate it, I believe is the correct thing to do. Then once you get to the bottom, you would want to secure it to the nose, which is regular tape. You basically put it on the bridge of the nose, the end of the nose, put it on the bridge of the nose, and then wrap it around the tube. And from there, I forgot to mention, we would place this over the patient so they don't get wet or anything. So after that, you have it taped to the nose, just a quick little tape job. you would switch gloves or put on new gloves. And then at this point you would attach a syringe or something to the end of it, just like this. Pull out whatever is in there. And you will see it should be bile. It should just be bile. Be like normal color, a brownish, greenish, yellowish tint. And just basically pull it out, see if you've reached where you have to be. Then you also measure the pH of anything that you pulled out. Just basically assess the content that it comes out. You know, you just gotta check it. After you confirm that the tube is placed in the correct spot, after you place it in the correct spot, you secure the tube. You take off the tape from the nose. You apply a lubricant or a skin barrier, I think. Just apply a skin barrier, wait for it to dry, and then remove your gloves and everything. And then you would secure the tube. Basically just secure it even better with the tape, basically over the nose, and attach it to the thing. Basically one tape and then a bridge, like completely a strap going across, and then attached. That also a package stuff would come with it. If you want to use that, or just use tape, as I said, just tape it like that. Well, first you want to attach it and then tape it over. After that, you want to. I think that's it. You just want to, after you tape it, and you want to attach the rest of the tubing, attach it to the gown that they're wearing, clamp the tube, I think that's it. You insert the tube, reinforce it to the gown. Basically, you just want to keep it as reinforced as possible. You don't want it to get loose or anything. So after that, you would also assist with oral hygiene every 2 to 4 hours. Lubricate lips. That's all. Remove, clean everything up. Return on. After, also forgot to mention, you want to set the patient at high Fowler's, 45 degrees. And that's basically it for that. From right here, now we'll just move on to removing the tube. What we do, walk in, perform hand hygiene, of course, explain what we're going to do, pull privacy, pull the curtains, lower to working table, put them at 45-degree angle, place a towel again so if nothing happens, place a basin just in case, put on new gloves, carefully remove the tape, check placement, and then you would flush the tube with 10 milliliters of water or normal saline, and then clear, and then clamp the tube with fingers by doubling the tube on itself, like basically, wrapping it around, and then clamp it. And then after that, you ask the patient to take a deep breath, hold their breath as we yank it out. We want them to hold their breath. Coil the tube, basically like this. And it's a disposable thing. And dispose it. And then offer mouth care. And that's basically it for that. Again, sorry, I don't know. We didn't have the equipment, or I don't have the equipment. I'm not sure. That's my fault. Alright, thank you.